Hello guys, so now we start with our biomechanics course. Actually, we start with the basics. I know that for most of you this is something very simple and you must know everything or almost everything regarding this, the first part of our class at least. But I think it's important for us to create now just biomechanic language, something that we can communicate during our course. So this is important. If you want to accelerate this, you can do that, or if you want to skip to another part of our course, it's okay. But keep in mind that this is important because from now on, we're going to communicate using this kind of language. Vectors, for example, are very important for us to communicate, for us to establish points that are important for our biomechanics. So we start with the basics and then we go on and on and on, increasing our knowledge in biomechanics from now to the end, from now to the vectors and the moments and everything, and from now to the clinical use of this kind of concepts, okay? So, biomechanics in orthodontics, let's talk about force. A force is something that makes or tends to cause a change in the motion or shape of an object or body. In other words, force causes an object to accelerate or decelerate. It is measured in newtons, but in orthodontics, as you know, we just communicate in grams. We always use grams for that, even though we know that Newton is the right way to address the forces in the physics, okay? But now we are going to say grams from now on because this is how biomechanically we speak of forces. So let's move on. We are talking about the magnitude of the force, the direction, the point of application, line of action of the force, and sense of the force. So those things are present in our vectors, and we are going to use this kind of scale for understanding and for representing the vectors in one system of force in orthodontics. Meaning, I'm going to go to do a length. I'm going to go to arbitrary a length because from there I'm going to represent other forces in our system. If I'm using 50 grams for 5 millimeters or 5 centimeters of length, if I want to increase that for 100 grams, I need to double the length of the vector because I'm using the same scale for that. And this is what is important for us. The length of the vectors is proportional to the magnitude of the force. The actual length is arbitrary, as I told you before, and depending on the scale that we are using. But all forces in a diagram, they must be on the same scale, meaning I have to keep the scale to represent other forces present in my diagram. So in common sense world, let's say if we are applying a force, we know that when we apply a higher force, a higher magnitude of force, I'm having a different outcome for that. For example, I'm pushing something. If I apply more force, I can go with that thing, that body in a longer distance, for example. Here we are seeing a beautiful score, a beautiful goal by Leo Messi. And if we apply a higher force in our kick, we are going to have a more accelerated ball going to the goal, okay? But it's not the same thing with biomechanics, with orthodontics, because we are not applying a force in a free body. We are applying a force in a restrained body, in a teeth, in a group of teeth, in a tooth. So they are surrounded by periodontal ligament, by the bone, by the gingival attachment and everything. So we know that when we apply more force in orthodontics, the objective here is probably not being achieved because more force doesn't represent in biomechanics, in the force we apply to the teeth, more movement, because those teeth are restrained, and the ligament, the periodontal ligament, it's something that has to be respected biologically. Meaning, I apply more force, I'm not having that cascade of events triggered when we apply a low force to that structure. We may block our movement. We're not talking about this today because this is not the objective of our course, to explain everything about biology of the movement, the movement in orthodontics. But we are from now on just speaking that, understanding that you know that we don't need to apply much force in orthodontics. It's not like a free body, it's not like a ball, it's something that we need to respect the biology present in the periodontal ligament, okay? So from now on, I'm not explaining more about much force and about the biological events that are triggered when we apply much that higher force or lower force, because we imply that you understand that, okay? So let's move on. So if we have a force applied for a certain period of time, we will have that events occurring inside the periodontal ligament, meaning we are going to have bone resorption, not root resorption, bone resorption in one side and bone formation in the other side. So this is what happens in orthodontics. A very, very quick summary of what happens, but I think you know that, I'm sure you know that. The direction of the force, it's important for us. Of course it is, because we apply a force in certain angulation to a determined structure. For example, if I use a fixed axis to represent my point of application of force and direction of the force, I may go from there to the resultants of the force. Meaning I'm using, for example, an elastic for doing the retraction of anterior teeth. I need to understand all the forces present there. I'm not having just the force that I want, which is mesial distal displacement of those teeth, but I have other forces, other resultants that may have, I may consider, because they have some effect on the body and have some effect on everything that I'm applying. Meaning, I'm doing that force, I want to have the distalization of the upper arch, but there are other forces present in the system that may jeopardize the outcome or may help me. I don't know what I want. So this is something that I have to keep in mind. The direction of the force, the angulation of that line of action of the force in relation to some kind of reference. In this case, for example, the occlusal plane. We use the occlusal plane as a reference because it's a good horizontal reference and it's close to the point of application that I'm using. So the center of the line of action of the force and this angulation that we have may have some kind of bad or good side effects in our mechanics, okay? Point of application, line of action and sense, we can see that in our vectors. I'm applying the force to distalize this tooth, for example, and this point of application, it's obviously almost always in the center of the crown. And in this kind of situation, I need to understand the side effects or the other forces or the resultant of the system, the quality of the movement. I've told you before, that's not the amount of the movement that we are going to apply more or less force. It's more about the quality of the movement. Is this a translatory movement? Is this an inclination, a tipping, uncontrolled or controlled tipping? Everything is about this vector, the point of application, the line of action of the force, and everything. I'm so sorry to go like very speed here with this very fast here, but I know this is something for the majority is very, very well known. So because of that, I'm going a little bit more faster, okay? So point of application, I can change the point of application, and we are going to see that sometimes we have more than one point of application of the force. I may have just one point of application with two forces also. So everything needs to be measured, needs to be understood for us to have the best outcome for that, okay? Just this quick reminder, just this quick introduction for our course. We move on from here, understanding more and more about the line of action, about the force, and about the resultants that we have when we apply this kind of force in orthodontics, okay? So see you soon. Stay with me. Bye-bye.